How do you know which is best for you between a dental implant or a dental bridge? I'm Dr. Annoni, and I'm going to help you answer that question. But first, let's delve a little bit deeper and find out more about each of these procedures by examining the pros and cons. Let's start with a dental bridge. Imagine a dental bridge like the Golden Gate Bridge in San Francisco. It has to have a strong anchor on both land masses to maintain its stability. The only way to achieve this stability effectively is to create strong anchors on either side. So each tooth surrounding the space has to be shaved down so that the anchor crowns can be cemented onto them and provide stability for that middle crown. Now, the same thing applies if multiple teeth are being replaced. But the longer the span of the bridge, the more teeth we need to make it stable. Now, personally, when I need to make a big decision, I like making a pros and cons list so I can visualize everything. Let's talk about the pros of a dental bridge. Number one, the bridge is fixed. You can't take it out the same way that you would a partial denture because it's permanently cemented into your mouth. Number two is longevity. A bridge should serve you well for several years. In fact, there have been studies conducted on 3-unit bridges showing that the 15-year survival rate eclipses 90%. That's pretty dependable. Number three is time frame. If you need a tooth right now, a bridge may be a good option for you. Some offices may even be able to mill them in-house, but at most you'll be waiting about 2 to 3 weeks for your finalized bridge. Number four is financial. Oftentimes, a bridge will cost less than a dental implant, depending on the material used and how many teeth you're replacing. Additionally, sometimes insurance plans will cover part or most of the bridge as well. While all of these pros sound great, it's important to evaluate the cons as well. The number one con is cleansability. Since the bridge teeth are connected, you can't floss in between the teeth. You have to actually floss underneath the bridge and make sure that you're clearing all of the food debris and plaque. With difficulty in cleaning, bridges can sometimes create a plaque trap. That actually leads me into number two. Number two is each of the anchor teeth can be pretty negatively impacted by those food traps. Since the bridge is dependent upon these anchor teeth, if any of them get decay or fail for any reason, the entire span of the bridge fails. And that takes me to number three. You've got to consider the anchor teeth. Oftentimes, the teeth surrounding a missing tooth or a space are perfectly healthy. So you have to consider if you are willing to shave them down completely so that they can hold on to the bridge, because that does expose them to decay in the future. The last con is one that people often overlook, and that's bone atrophy. Over the years, if there's nothing stimulating and utilizing the bone, it begins to resorb on itself. So while a bridge looks like it's replacing a tooth, what you may notice over time is that the gums and the bone will start to recede. To touch upon an earlier point that we made, the more teeth that are missing and need to be replaced, the longer the span of the bridge. With a longer span bridge, the predictability of long-term success goes by the wayside. However, dental bridges have worked really well for many people over time. Is it the right option for you? I'll give you my opinion on that in a little bit, but first, let's look at the pros and cons of dental implants. If you've ever tried to eyeball hanging a curtain rod, you know the frustration of drilling right into the drywall. Eventually, I give up. I go get my stud finder, wave it over my husband, tell him I found one, and then use it to find the solid 2x4 in the wall. That's gonna hold up my screw a lot better. A dental implant is much like putting a screw into this 2x4. A strong, solid jawbone is going to be the perfect place to hang your tooth off of. Let's take a closer look at how a dental implant works. Much like putting a screw into the 2x4, our surgeon needs to make room in the bone in order to accommodate the implant itself. Once the space is created, the dental implant gets screwed in, and after a healing phase of about 4 months, your bone will actually grow into the implant, and it'll be ready for an abutment, or a connector. This connector is what links the implant to the crown that gets placed once it's healed. Now for the pros of dental implants. Number one, the 15-year success rate of a dental implant procedure is between 95 and 97%. That's stellar for a surgical procedure. In fact, it's 10% higher than the success rate for a hip or knee replacement, which is about 85% according to the National Library of Medicine. To put it into further context, 96% of people who receive LASIK surgery report it as successful. That should boost confidence, knowing that dental implants are at the top of the list of successful surgical procedures. Number 2 is cleansability. Since a dental implant is not one big piece, and rather just one individual tooth replacement, you can treat it more or less the same way you would a tooth. Flossing and brushing around it, a breeze. And that tooth will not be susceptible to cavities. And since we're talking about the individual dental implant as opposed to a long spanning bridge, let's look at that a little bit more closely. It brings me to number 3. A dental implant does not need to involve its neighbors to create anchors. It stands alone. What that means is if you have healthy teeth on either side, we won't need to drill them. And if anything ever goes wrong with one of its neighboring teeth, you can take care of them individually without affecting the dental implant, or vice versa. The last pro I'll discuss is that a dental implant maintains your bone volume. You won't be experiencing the same kind of atrophy that you would if you had a bridge, since the dental implant is actually stimulating and utilizing the bone it sits in. All right, let's talk some downsides. For dental implants, really, there's only 2 things that I would say we need to take into consideration. One being time frame. It can take longer for a dental implant to reach its final restoration, typically about 4 to 6 months. And the last thing is finances. Oftentimes, a dental implant will end up costing more than a bridge. But as with anything in life, you get what you pay for. A dental implant is a little bit more involved. It's more of a surgical procedure. Whereas a bridge involves things that are superficial to the gum line, the implant actually goes in deeper and involves the bone. So while it's a bit more involved, there's definitely a lot of upside. One more thing to consider when replacing a missing tooth. Not every provider practices the same scope of dentistry. So while some providers might specialize in a single tooth replacement, others may focus solely on crowns and bridges and have no experience with implants. Here, we focus on full arch restorations, so replacing the whole mouth of teeth. Traditionally, this whole mouth treatment takes several months up to a year to accomplish to give you permanent teeth. But now it can be done in just 24 hours. To see if you're a candidate for this, take a quick 60-second quiz in the description. Now for my opinion. If it were me and I needed to replace a tooth or two, and I were a candidate, I would go implant every time. I wouldn't want to harm the teeth next to the space that I need to fill. Now, I've definitely seen plenty of bridges that have done the job and stood the test of time, but I've also seen plenty of problems associated with them. Based on what I've seen between bridges and dental implants, implants seem like the smarter bet. Although an implant may demand more cost up front, it does seem like a better investment in my opinion. Why? Because if anything goes wrong with any of the surrounding teeth on a bridge, then you're out to replace all of those teeth at once. My best advice is that you sit down with your dentist and discuss all of these pros and cons as they pertain to you specifically. Because keep in mind, not everyone's a candidate for dental implants. In fact, there's several reasons you absolutely should not get dental implants. For more information on that, tap this video right here to see Dr. Heimer explain it.